Hi, I'm Dr. Becky Coats with TMJ. I want to share with you what happens when your jaw gets stuck. I don't know if you or a loved one have ever had that moment when you're out and in a social situation or with family and you're literally unhinged, you're locked. That emotional panic, that feeling of what I'm going to do. Am I going to cry? Am I going to start sweating? How am I going to fix this? Am I going to just keep making it come unhinged? So I want to show you what's happening so you understand how big of a deal this is, and for many patients how we've helped them. In the spirit of Halloween coming up, let's look at a skeletal view. So basically in this view, when you might be stuck, you probably are off balance. I don't know if you can see how the jaw is like tilted over this way, kind of like this. That would be a sign. If you look at yourself, obviously you're going to be tilted. What's happening on the inside? Let me show you. I'm going to do a quick video here. This is your jaw joint on the side. So when you're trying to open and you get locked and you can't finish eating the meal, this is what's going on inside right here. You can't get past this point here. Really what's happening is that tissue is being basically shredded, or your jaw joint becoming flat bone to bone. The more times that it happens again and again, even though you might be able to get yourself unhinged or unstuck, the problem is not going to go away. You have a severe temporomandibular disorder. What was that video really showing? That's the tissue that allows your jaw joint to open and rotate and slide. So it's kind of like saying this. This pocket of tissue you just saw, it's stuck in front of this bone right through here, your temporomandibular joint, which is right in front of your ear. You can feel and palpate it. So when you try to open, this tissue is out of alignment with the bone, so you get stuck. And the more times that it happens over and over again in your lifetime, you can open less and less, which you're not in control of that. And how do you fix it? And that's not something when it occurs or on a weekend that you can have it fixed in an emergency room. What does that look like? How it's a big deal on an x-ray. When you get stuck over time and that jawbone is scraping bone to bone, you might notice this side is more round. That's the top of this joint. And the more times that you become stuck or popped or locked and you think, oh, well, I got it undone, or I can just take Advil, or you know, I didn't really think it was that big of a deal. It is. What's effectively happening is your top of your joints getting shaved down, worn down. That's degeneration. That's what's happening when your jaw comes locked. Also, what happens is this jaw joint is further back in this fossa, like right in front of your ear. It's stuck back. This is how much this patient had worn down. It's not from the top, but it's also from the side. So what to do when your jaw gets locked? Here are some key points. Remain calm. It's going to be okay. Breathe. Long, slow breaths. If you go to the emergency room, because that's what probably you think, oh, I have to have something done right away, you're going to spend an expensive emergency room copay, and you'll probably get a muscle relaxer. You're not going to have someone manipulate your jaw. You're probably not going to have a joint injection to have relief. That's where I can help. So what's the best thing to do? Don't chew gum. Have a soft diet. Maybe some ice to help. Anti-inflammatory, yes. But until you have an appointment to seek relief to get your jaw centered where it needs to be, and you're out of pain, then you need to take steps so that never happens again. Why is that important? Don't have the bone become compressed or worn down, but more importantly, not ignore the problem so you don't wind up having TMJ surgery. That's my tip for today. I invite you to make an appointment so I can meet you. I'm Dr. Becky Coats with TMJ.